This is Chepungu's location in Loyamorok, Tiaty constituency. The landscape is breathtaking, full of rolling hills and stark, rocky outcrops that are lovely to behold. It is dry here, and the little vegetation in evidence is tough shrubbery that only the bravest and hungriest of goats can eat. This is home to the Pokot people, a proud and brave people who are unfortunately living in dire straits. Here, many things that are commonplace to most Kenyans are complete luxuries. Water, education, proper roads are all lacking here. But by far, the most glaring problem is that of healthcare.
Sasa shida hakuna hospitali hapa na shule hakuna na maji hakuna, lakini shida sana ni hospitali.
Tulikuwa na shida mingi sana mpaka hata sasa hii bado bado hajapungua hata. Shida ni watu wamama wanasa wanapoteza watoto kwa sababu hakuna matibabu.
To fall sick here is to play a game of chance with fate and death. The nearest health facility is over 70 kilometers away in Chemalingot Sub-County Hospital.
Sasa hospitali ni Kabarnet, huko naitwa Chemalingot, Angulubei ni kilomita 70. Huko ni kilomita karibu 80. Hakuna mwenye anafika huko, unaenda mpaka njiani unakufia hapo na inakuwa hivyo tu.
Emergency medicine here is non-existent, and many die from minor ailments that even basic first aid would take care of.
Hii watu wanakonjeka na kumbe iko disease ambayo inasekana hata kuna typhoid iko ingine hata tujui.
Ask her about that.
This total lack of help is what motivates Teresa June, a missionary into the area, to step up and provide the desperately needed health services to the locals in what is known as bush medicine.
I found a lot of mothers have a problem with when they're birthing babies. You know, this place is so dry and there's no clinics here, there's no hospitals. For between 30 and 50 kilometers is the nearest clinic or even dispensary. And so there's a lot of mothers dying in childbirth. There's a lot of babies and mothers both dying.
June speaks of the horrors experienced by locals, especially women of childbearing age.
One day I come up here and a mother had just given birth 3 days ago. And at that time, before the borehole, there was no water here. And this mother, 3 days, had not washed herself, had not washed the baby. Even the baby had dried blood all over it because there was no water. Can you imagine?
Life here is cheap, and death is a constant guest in their homes. Newborn children do not get immunization, and mothers too have no prenatal care.
I found a lady over under a bush yesterday. She's in labor, had been in labor for 2 days already. I took her, I have a hut over here, so I picked the lady up, took her over there and put her in my hut. And so the doctors and myself, we've been going back and forth, checking on her as she's in labor. But we're leaving this afternoon. And this lady, what are we going to do? I mean, you know, that's what all these ladies do, and we just pray for the very best.
This humble structure, constructed from twigs, is what passes for a hospital in these parts. A bush hospital. Babies are weighed on a scale borrowed from a posher mill. Everything from maternity care to eye care is dispensed with under a tree. Through interpreters, June gives prescriptions to uncomprehending but desperate locals who have had little to no medical care. Many believe that it is a lack of education that makes the problem even worse.
Sisi nasemekana ni watu wabaya kwa ajili ya hakuna shule yenye watu wanaenda kusoma ndio angekuwa amechanuka kidogo. Paka saa hii mama paka ndiye alete dawa anatoa kwa huko sijini kwao ama ni wapi anakuja kupea sisi bure.
This woman cannot put a string through the colorful beads that she wears. Turns out that one of her eyes is blind. This man complains of a running stomach and weak muscles. Turns out it is typhoid. These children have a large cocktail of diseases like kwashiorkor and marasmus. June and the locals are calling on the government and well-wishers to respond to the plight of these people. Despite the area having a potential of tapping 3,000 megawatts of power from geothermal deposits, and indeed with the geothermal development company already having a presence in the area, quality healthcare, education and food remains nothing but a dream.